So we did a driver diagram here, which has just broken down those areas that I've just been through into more detail to see what we needed to work on. So to increase the number of patients, we were all going to do that in clinic to identify those that would be appropriate. We were going to put on more schools to initiate the startups, which has been extra challenging due to COVID. So we'd had to do most of these virtual and figure out a new way to do this, as I'm sure you've all had the same problem. And we needed to, we also, because of our kind of new staff and our shortages with sickness and things, we've also used the reps a lot more than we normally do for initiating some of the CGM startups. Looking in more detail at improving the self-caring. So we introduced a carb counting quiz on our Piota app to identify their current level of carb counting skills so that dietitians could offer focused reviews for those that were struggling, as well as their regular annual reviews as well, and as well as the new patient intensive carb counting that we do. We decided we were going to push to get everyone to be bolusing 15 minutes before they eat. And we've had a real push on that in clinic. We've also pushed that in on our clinic letters. We've got our 5 golden rules, which I'll talk about in a minute as well. So we've really pushed that from multiple different angles to make sure that they're all doing this. We've improved our health zone app as well. We've got a lot more of the information on that. So we signpost them to that at diagnosis. We also re-signpost it to them in clinic. We also encourage them, if they do a pump start or a CGM start, to make sure that they've got that downloaded. So it's got loads of useful information on that for them. And we also wanted to upskill their ability on interpretation. Some of our patients have struggled with this actually, so that's something we have learnt. Some people just, really, however simply you explain it to them, they struggle to understand the concept of interpreting such a massive amount of data as you get from CGM. So these patients, when if they're clearly not managing with it, we still use the CGM, but we get them to keep a diary as well, so that they're not missing out on looking for the 3-day rules and not missing out when sugars are running high or low and leaving it too long to contact us when they're having a problem. Yeah, we also do a pump quiz at least twice a year to make sure that they know what's going on with their pump. And we've made sure, well, we've had a little bit of trouble with psychology at the moment because there's only one of Ash and a lot of patients, but we try and make sure they have regular psychosocial meetings, and we use the PIED questionnaire at the moment to identify anyone who needs extra input. So to upskill our staff, we have every Tuesday lunchtime we have a staff meeting, and once a month we've made that incorporating CGM reviews. So as a team, as long as we've got at least one doctor and at least one diabetic nurse there, we pick a tricky patient and we look at their CGM all together to see what improvements we've made. And I think that's really useful for upskilling the less confident members of the team to feel better about interpreting and making changes. We've also changed the way our diabetic nurses are working together. So they now have a Monday meeting so that they divide all the clinic tasks between them. And they make sure things are allocated fairly and evenly. And we also identify those with high HbA1cs who need extra support. Obviously, the quality improvement project is based on time in range, not high HbA1cs, but as we know, they quite often go hand in hand. So yeah, we make sure that all the staff are fully aware of what's going on and who needs that extra help. So that was all what we meant to do. Obviously, we've had the same challenges as I suspect most of the other units in the region have had. So we've had nearly double the new patients, new diabetic patients this year as we have most years, which has really put a strain on our team, plus the strain of virtual working, plus the strain of kind of team sickness and team isolation due to COVID. So it hasn't been as smooth as we hoped, but nevertheless, I think what we have achieved through our hard work of our team has been quite impressive. So what I have done is I've just done 3 spot audits. So January, before was like our baseline before we started. April was midway through this QI project, and then July was just last week, so that's the most up-to-date data. And I just literally, it's a very crude spot audit, so I literally look through all our patients who are currently on LibreView, all that are currently on Diasend, and all that are currently on Dexcom Clarity. to look. So this won't be all our patients on Libra, it's just all our patients on Libra View, to just explain. And as you can see, we've had a good increase over the 3 months about on the patients on CGM or flash glucose monitoring. And then I looked on them to see the percentage that were achieving the time in range. So it's very small. You can see the green line is time in range above 70%, and the higher orangey line is the time in range above 60%. So as you can see, we made a really good improvement when we were pushing this over the first 3 to 4 months, and that's kind of plateaued over the last 3 to 4 months. But I think I think we're still way above baseline, really. So I think actually doing these spot audits has been useful because it keeps it fresh for the team about how we're doing, and remembering to continue trying to make those improvements that we've started to push in place. And so I hope, even though this kind of formal QI project is finished, we want to continue looking at our data every 3 months to see where we are and how we can continue to improve. So a lot of these, what we've achieved, I've mentioned already when I was talking through the driver diagram, but just to highlight, we've had lots of new patients put on CGM and Libra. We've run many schools, approximately every couple of months we've had a new school with a group of patients. We've put the golden rule to success. We're trying to spread it as much as possible. So these are just simple things like test your blood sugars at least 5 times a day, inject 15 minutes before meals. These are on the end of clinic letters as well, so that every 3 months as well, they're remembering to do that. I've talked about the carb counting quiz. I've talked about the staff education. I've talked about the Monday meetings that we've implemented. So they were a bit of an evolving process as well. So initially, because they were using, I think, almost as a team debrief, because we had so much going on and so much about patients we needed to discuss. So now they're much more structured. They have an agenda, they have a lead for the meeting, and then they allocate tasks appropriately to the relevant people and have it all timetabled in. So actually we can work much smarter and more efficiently with the same amount of staff, but more patients. We're reinstigating our nurse-led phone clinics. We also did, this was Liz, one of our PDSN's initiative, but I thought it was brilliant. So when we weren't doing face-to-face, which we had a long period of time we weren't doing, we actually did drive-through HbA1c. So they pulled up in their car, stuck out their finger, had their finger prick and drove on, which I thought was really useful for keeping people on track, to keep their HbA1c on track, but also consequently, hopefully that will improve their time in range as well as part of our quality improvement project. We noticed on the data when we split it by site, there was a bit of inequality between our City and Sandwell site, and that might be partly to do with our slightly different patient populations at the 2 different sites. But what we did is we had a group meeting to make sure we were treating patients at the 2 sites the same, and check that the things we were doing slightly better at one site, that we use those best practices for both sites as well. So hopefully that will transpire into improved time and range. And we've now got a registrar with an interest in diabetes, so we've put her onto the case as well, and she's doing a more in-depth audit of our current technology use and the access that our patient population has to IT and things like that, because that's one of the limiting factors with our deprivation index. So further actions, I think we just need to continue to pull together to maximise the efficiency of the team. We need to continue working on all our aims that were outlined in our driver diagram. We've not achieved our target yet, but we're certainly heading in the right direction slowly. We need to try and make every contact with our patients count. And I think it would be a good idea to keep up the 3 monthly spot audits and include that in our diabetes meeting so that we don't lose sight of our target and our aims. And that's the end from me. Thank you.